Welcome to another episode of What Did the Patient Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hi, everyone. Welcome back to another episode of What Did the Patient Say? I'm Dr. Lauren Brindisi, and I am here with Maddie and her mom, Alyssa. Thank you guys so much for coming on.
Thank you for having us.
Thank you.
So we're going to talk a bit. I know that I have been working with you for quite some time now, so I'm excited for you guys to tell the audience how things have been going. So Maddie, what diagnosis or symptoms were you experiencing initially?
First symptoms were basically just hard of breathing and lightheaded. What else? Just lightheadedness, kind of rolling of the eyes, kind of hyperventilating. I don't know.
She just felt like initially was the summer of her sixth grade year, going into sixth grade for summer workouts prior to, and she would text me and just say she felt like she had an elephant sitting on her chest, and had a hard time breathing, and then that was the initial symptom was that, and then it just kind of progressed from there. But that would have been the first one.
Okay, so what happened from there? Where did it progress to?
Progressed to where while she was at school in class, she would just kind of randomly get like dizzy, and she would feel like she was going to pass out. She would stand up and start walking, and then she would pass out, and then her hands would kind of constrict. So it went from there, and once it started, the ambulance would come up to the school, and they gave her oxygen and some other things because she was having a hard time breathing, and thought it might be asthma. So we went to an asthma specialist, and they said, yes, she has asthma. So we gave her some asthma, an inhaler to try, and that didn't work. And then so she went back and continued to have these episodes, primarily at school. And so we went and to her primary physician, and they gave her some medication they said it was potentially anxiety. So then we have anxiety and asthma, and those were the two that we worked around for a couple of years until it continually just kind of progressively got worse. And it was just kind of on a daily basis that there was something happening to where she was in and out, passing out, and to the point where it started looking like she was having seizures.
Okay. And after seeing primary care, did you guys see anybody else before finding us?
Not until it continued. Like I said, once it started to get to the point where it was almost daily, what they did when we would go back, it was increasing the anxiety medication dosage, adding a steroid inhaler, adding some, oral medication for the asthma. So it's just kind of compiling additional or increasing dosages and adding extra things to try to fix it when it's, it never did anything for her symptoms. So the one kind of tipping point where I went back to her primary care physician was after she ran a track meet. She passed out at the finish line, and her heart rate had dropped down to like 33. And so I told him, I called him back, and I was like, I really would like to see somebody else for this. This is just not, there's still something else here. And so then he started the series. We saw the cardiologist, we saw 2 neurologists and multiple MRIs, and, the cardiologist exam came back, everything came back, normal. So, but the cardiologist, one of the discharge papers, or when he referred us on to neurology, it had this one word in the diagnosis that said dysautonomia, and I'd never seen the word before. I'd never heard of it. And so I started Googling that and trying to figure out, like, what is this? And it made a lot of sense for their symptoms and what it said this was. And then that's how I came across your place, is that, it just aligned up.
Yeah. So at its worst, how frequently were you passing out, Maddie?
Probably every day, even
Yeah.
sometimes 2 times a day.
I started keeping a journal in 2021 when it just started becoming, and it was just there was some sort of symptom at some point. It was like daily. The other symptom that we didn't talk, her legs would go numb. There was one day I looked in the journal, it was 2 hours. She was just getting ready for school and she's like, I can't feel my legs. Like she felt fine. She wasn't dizzy. She just could not feel her legs, so she couldn't walk. So we just sat for, we got her in her bed and she just waited it out until the feeling came back to her legs.
Okay. And so you found us online and then you took the trip here. So tell the audience where you guys live.
Albany, Texas.
Albany, Texas.
Okay. So quite the hike over to North Carolina, and you came for an intensive week. Can you tell the audience a little bit about your experience when you were here?
We had to go, I think it was like how many times a day we go there?
4
or so. And each time was kind of a little different, but I don't know how to explain it.
Well, I mean, I found the first time pretty interesting because I really didn't know what to expect. The neurologist that we had seen on the Friday before we flew out that weekend, based on what she had seen with her neurological exam, was like, you do not need functional. Like they were trying to talk me out of getting her on the plane to go because of the state that she was in with what they were seeing. And so, but I was like, being functional, there was no, risk on my end as her mother. It was like, I've tried everything else. And, it's not, no more like prescription medication or invasive type things. Even though I didn't know what to expect, but, yeah, so we made the trip. She actually passed out on the airplane, to get there. And that was, an adventure in of itself to get back off the plane because she lost feeling in her legs. But once we got there, I mean, it was a lot simpler than I thought it would be. I was surprised by the simplicity of it. We get there and it's like, okay, relax, in a quiet room. And then it's, checking heart rate, checking blood pressure at, lying down, sitting, standing. And there was a lot of findings with her that I didn't even realize, like issues with her balance and her vision tracking. Those were huge. And being in there, the vision tracking, it would explain why sitting in her classroom, she would have what everyone called a panic attack, but it was just her eyes were working overworking just to kind of keep up with just what was going on in the classroom. And so I thought it was really interesting. One of the main things that I keep telling other people too with throughout this whole thing is just like, it is so simple. I mean, it's, therapy for your brain. It's just like if you were working out your body, but it's for your brain. And it really does help change how you can handle the other functions, how your body can just kind of be cohesive and work together. I was really thankful for it.
Yeah, Maddie did really well with treatment. So when she was here, we definitely uncovered some things that aren't as common in terms of a functional neurological assessment for dysautonomia. Often we're looking at brainstem function, but this is the interesting piece when we start to look at why someone may be experiencing these symptoms and what is actually happening neurologically. Maddie was having issues actually in her cerebellum, and the cerebellum works to coordinate everything the rest of the brain does, including your autonomic system. So head up and down. Okay, bring your elbows in, do the same thing. Okay, and then like you're playing the piano. Good, relax. Now take your left hand and good, and then the other side. So there's no medication that's going to specifically affect the function of the cerebellum. We have to do things from a rehabilitative perspective, just like you said, to actually exercise the nervous system. And we made really good progress in just a few days. So you guys were here for 5 days, I believe. Up and down. Good. Now bring your elbows in and do the same thing. Good. And then left hand go. Yep. And then other side. And then you went home. We started working via telehealth. And then you actually came back for a second session. And tell the audience kind of where you were at that point once, you had been going through treatment for it was like close to a year before we had you back.
It was a year, yeah.
I felt felt better, like felt very different. But I was kind of excited to get back just so I can take another step.
Mhm. After, I think we came to see you in August of 21, and I think there was about almost a month in between by the time that we left there. And then she had like what we called it an episode in September. So there was a good, 4 weeks in between after we left there. Whereas when we got there, like I said, the neurologist was like, no, do not go. Don't go. Don't take her anywhere. So we went a good 4 weeks. So we saw results with it fairly quickly. And then even after that, between September in January, in between there, she had gone snow skiing with a friend and had zero issues with that at all. And then I think there were 2 small episodes in February. And then after that, I don't have anything written in my journal until April of 2023. So going back for the second time, she was doing really, really well. She just still had, it was just, I think just to kind of build upon what we had already done because it was so successful. We didn't want to have kind of any setbacks. But so when we went to the second session, it looked a little different because we weren't working as much on, she got to do some of the kind of more fun kind of bring, more games and things, to where the first time we went, it was more just trying to kind of level her out. But
Okay, then bring your elbows in. Good, and then here. Perfect, other side. She's a pro, ladies and gentlemen. So originally we had to do things very passively. You were lying down a lot. We had you on the tilt table. We had to keep a really, really close eye on what was going on with your heart rate. Of course, you were coming in, passing out a couple times a day. So by the second time, that wasn't happening. You were getting back to your life. You were able to handle more stimulus. So we were able to do things seated and standing so that we could make the activities still supporting these areas of the nervous system that we needed to support, but doing it in a much more dynamic way that starts to mimic things that you're doing outside of the office. So tell the audience how you're doing now.
I'm doing good. I haven't had any episodes, I only had one, but that was back in
April.
And I really haven't, my fatigue has gone down significantly, I feel like. Because that was another main thing, was fatigue. That was one of the things I struggled with the most. But that's been going good. Just like being able to do the little things is really good for me, and just being able to like stand up and not having to sit back down so quickly. But everything is just, it's so much easier.
That's great. And just so everybody knows, it's September now. So if you do watch this video later, it's been a while since Maddie has had any episode, and even that one was the first one. And
it was the first one in the entire school year for her freshman year, and she's super involved in athletics and cheer. And that day it had gotten hotter during the day, and I don't think she had drank enough water, but she had track practice and went straight from track practice to softball practice. And so it was just that was a lot. But once in 1 year, that was like awesome.
Yeah, so that's great. So it's been, a bit of time since we started, but really you came here twice. You worked on activities at home on a regular basis. We did run some labs and, help support her in some other ways with diet and some supplementation. But for the most part, the neurological rehab was really the main take home here in what was extremely helpful and successful in getting Maddie back to her life. So at this point, I mean, we just had a telehealth call and she was basically dismissed from care. We'll keep up once a year and run some labs and just catch up on a yearly basis to make sure everything's still going well. And, we want to also be proactive and make sure that if there's anything that looks a little bit off, can we make sure that we're supporting her before it becomes more of a problem? Do you guys have any other comments about what you're doing on a regular basis now to help with maintenance?
She takes a few of the supplements for like adrenal function, but beyond that, she's kind of over she really doesn't do anything but just she's just living her life now. So yeah,
That's
she's
amazing.
over the exercises.
No, that's great. I mean, that's where we want to get people. You've been on this journey for a while and working hard. And a lot of people ask us, are these things I'm going to have to be doing for the rest of my life? Like, what does long-term look like? And while it is different for everybody, Maddie has worked hard for several years at this point, and she's at a place where you're getting back to your life. You're not necessarily thinking about this stuff all the time. And I'm just so happy for you.
Thank you.
Thank you. We appreciate you.
Well, thank you guys so much for coming on. We appreciate you sharing your story with everybody else and helping other people get the care that they need.